Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey. Here when you need us most, now and always. The New Jersey Education Association. Johnson & Johnson. MD Advantage Insurance Company. NJM Insurance Group, serving New Jersey's drivers, homeowners, and business owners for more than 100 years. The Fidelco Group. The New Jersey Board of Public Utilities Clean Energy Program. Prudential Financial. And by the Adler Aphasia Center. Promotional support provided by Meadowlands Chamber. Building connections, driving business growth. And by bestofnj.com. All New Jersey in one place.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
I don't care how good you are or how good you think you are, there is always something to learn.
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
Hi, I'm Steve Adubato. Welcome to another compelling program where we talk to leaders who make a difference. And right out of the box, our good friend Tony Russo, president of the Commerce and Industry Association of New Jersey and publisher of Commerce Magazine, one of our media partners. Good to see you, Tony.
Good to see you, Steve. Thanks for having me.
Tony, we're taping on the 22nd of June, be seeing later. There will be a budget, an official budget on July 1st, 2021. Why does that matter so much to you and the members at CIANJ?
Well, every June is always important because what the state does with our tax dollars and the programs that they're going to fund, potential fees, taxes, that's something that we always pay attention to. So what's going to happen this week in Trenton is important. And for the first time, as long as I've been working here, the fact that the state's flush with money doesn't happen every year. And so this is going to be very interesting to see how the money is spent. So we're going to want to track it and monitor how that process goes.
Tony, if you were not the president of the Commerce and Industry Association and you were in fact the governor of the state, and you had this, it's not an embarrassment of riches because nobody's embarrassed because there's a surplus. What do you believe the best way to spend that money should be?
It's a great question, Steve, and my response would be what our businesses do. Whenever they have a profit, if they're fortunate to have one, they reinvest in the company. They purchase new equipment. They reinvest in their people. So the same thing should apply with the state: is reinvest in the infrastructure, reinvest in our workforce. Spend money, save money too, and that's a big component of it. Our businesses are obviously counting every dollar and making sure that the money is going to be there for the next crisis, because it's not, if, it's going to be when, and we just want to be prepared for it. So, my advice to the governor and the legislature would be to just reinvest a lot of that money, pay down debt. A lot of our businesses do that. And so when you have the opportunity, where you have the money and you have the cash, you got to do the right thing and really take care of debt, reinvest, and take care of your employees.
Tony, let me ask you, we've been media, you've been our media colleague for a long time, and you've talked a lot about the workforce. Dr. Joe Bloom at NJIT, the president there, talks about workforce issues a lot, the workforce shortage, et cetera, talent pool. Is there, in fact, a hiring shortage out there right now?
No, there certainly is, and that's not a secret. I mean, this has been going on for a few months, and we've tried to raise that level with folks here in Trenton. But yeah, I talk to Steve. I talk to, no matter what sector of the business I'm talking to, they're always looking for new people, whether it's accountants, bankers, truck drivers, operators. So there is a shortage of workers out there, and you could point to a few things, right? I know a lot of folks are saying that the enhanced unemployment's keeping people home, but I also think that now we have a situation where we're coming out of the pandemic, the economy's starting to pick up. Folks want to hire. We just need a qualified and skilled workforce, and that's not easy to find.
And by the way, childcare issues, we have a series that we're doing called Reimagine Childcare, which we're talking about quality, affordable childcare. Don't kid ourselves, folks. Childcare is a part of that equation as well. Hey, Tony, how about this? The workplace moving forward? You talk to your members all the time. By the way, let's put up the Commerce and Industry Association website so people can check out what Tony and his colleagues are doing. Tony, how much of it do you believe will ultimately be a hybrid situation? In person, remote? We're totally remote right now, but we're unique. We're not unique, but not everyone can do that. Talk to us.
Yeah, look, that's the threshold issue right now that a lot of our members are facing is, how do you bring employees back, right? We represent manufacturers that have been there since day one. They can't afford to have people working remotely. But when I talk to our service providers and insurance companies, bankers, accounting firms, what they're telling me is that you're probably going to see a hybrid model stay in place where they're going to want to give their employees that flexibility to work from home. But, they stress the importance of coming back to the office, right? There's structure there. There's collaboration with your coworkers. I think that's going to happen. And I think it's just a question of some companies are bringing folks back in the summer. Some are waiting until after Labor Day. You hit something very important, and that's childcare. Schools are going to be reopened. So, I think come September, the fall and beyond in 2022, don't be too surprised if you see the model as a hybrid where people work maybe 2 days in the office and 3 days from home. And I think that's going to be the model moving forward. And the reason being is, and a couple of members have told me this, if you don't offer that flexibility, I think employees will have choices and they'll leave. So it's a question of if you want to protect your good employees, you got to provide that flexibility. And I think what we learned over the past year is that a lot of employees have worked effectively remotely, and that production was there. So it was good.
Tony, let me try this. The whole question of moving forward, to what degree do you believe, and we talk about leadership a lot, right? To what degree do you believe your members will be most successful who are constantly pivoting, adapting, evolving, and not saying, I want to go back to normal?
I think the overwhelming majority of them are going to adapt. And that was the lesson learned from the pandemic is if you stayed the same, you basically languished and you faded away. You went backwards. And I think they realized that the name of the game in this global economy, Steve, with technology changing so rapidly, with the economies of the world changing so rapidly, with the issues that pop up, you have to come in every day to work and just say, what is it that we need to do in order to stay ahead of our competitors and to stay viable? And I think those are the companies that are always going to be successful.
Tony, before I let you go, the role of banks, speaking about evolving, the role of banks has dramatically changed, providing managing the PPP process, et cetera, et cetera. The role of banks in this pandemic now and moving forward is 30 seconds.
They were the lifeline. They were the ones that got it done along with the SBA and the federal government. Without our banks, our companies didn't get that, money that they really desperately needed. So it was important.
That's Tony Russo. He's the president of the Commerce and Industry Association, also the publisher of Commerce Magazine. You saw his website. They're one of our media partners. Hey, Tony, thank you so much. Best to you and all of your members at Commerce.
Same to you, Steve. Thank you.
I'm Steve Adubato. That's Tony Russo. We'll be right back.
To watch more one-on-one with Steve Adubato, find us online and follow us on social media.
We're now joined by Chris Paladino, president of New Brunswick Development Corporation, otherwise known as DevCo, and also Dr. Stephen Libutti, senior vice president of Oncology Services at RWJBarnabas Health and director of the Rutgers Cancer Institute of New Jersey. Gentlemen, good to see you.
Good to be with you, Steve. Steve. Yeah, great to see you, Steve.
By the way, RWJBarnabas Health, a significant underwriter of public broadcasting, as well as the work we do in healthcare. Chris, let me ask you, we're about to show some renderings. I'm going to put this into perspective. There is a very significant cancer center groundbreaking coming up. This will be seen later. What is this building, this cancer center, and why is it so significant?
Well, it's it's an extension and expansion of the legacy of the Rutgers Cancer Institute in New Jersey, which is the only NCI-designated cancer institute in the state of New Jersey. It's going to provide 530,000 additional square feet for research, clinical care, and for the first time, inpatient care for oncology patients in the state of New Jersey, all in one building. It'll be a standalone cancer hospital. And it's just going to, allow the folks who work with Dr. Libutti, either as researchers as physicians, as other diagnosticians, to be able to provide state-of-the-art, world-class care close to home in the state of New Jersey.
Jump in, Dr. Libutti.
No, I think Chris said it very well. The exciting part of this project is that the citizens of our state won't have to feel compelled to travel out of state for exceptional care and to participate in cutting-edge clinical trials. A facility like this is really something that's going to set a new standard for the state of New Jersey. As Chris mentioned, both inpatient and outpatient care taking place in the same building that allows us to coordinate that entire cancer journey for patients. If a patient's an outpatient and then needs admission to the hospital for some additional care, the same team will be caring for that patient. And so there's no need for transition of care or complicated communication. It essentially wraps a blanket of support, reassurance, and care for that patient as we navigate them through their cancer treatments.
Hey, Chris, explain to folks why the New Brunswick Development Corporation, DevCo, is even involved in this in the first place.
Well, this is another example of, in New Brunswick and more and more across the state, how we help build public-private partnerships, particularly with our anchor institutions. This project is obviously led by Dr. Libutti and the Rutgers Cancer Institute of New Jersey, but it is a partnership with RWJBarnabas Health, the Middlesex County Improvement Authority. Middlesex County has contributed to this, the city of New Brunswick. It really has, it has so many multiple dimensions. As part of this project, we're building this across from Robert Wood Johnson University Hospital on the site of what had been the old St. Peter's High School, and then had been for a short time, a elementary public school. And as part of this project, we are building a brand new $55 million community school, about 5 blocks, for the community as part of this. And it's just another great example, particularly of how Robert Wood Johnson Barnabas Health System really does act as an anchor institution, affecting so many of the lives of the greater community.
Dr. Libutti, let me ask you a larger question about cancer care as we do this program at the end of June 2021. The impact of COVID on cancer care, describe it.
So COVID has obviously been a major challenge across the board. It's certainly been a challenge for those of us that are focused on cancer care and cancer research. And one area that it's impacted tremendously is cancer screening. So during the periods of lockdown and during the periods before we had a vaccine for patients, people were not doing the typical screening exams that are necessary to detect cancer at an early time. Mammograms, low-dose CT scans for lung cancer, colonoscopy, and data from the National Cancer Institute predicts that we may see increases in cancer mortality and cancer incidence over the next 5 to 10 years as a result of that decreased screening. And so one of the areas that we are particularly focused on is increasing cancer screening and early detection through a partnership we have with the state of New Jersey called Screen NJ, which focuses on screening.
I want to be clear, Doctor, sorry for interrupting. Part of the concern is that if we miss on the early detection end, there are greater risks of serious illness, if not mortality. Am I
absolutely correct? Absolutely correct. And so we tend to diagnose cancers at a later stage if we don't detect them during screening, and often at a later stage, they're much more difficult to treat and results in higher risk of mortality.
Chris, let me ask you this. You and I have had so many conversations offline about a whole range of issues, but when it comes to the impact of COVID on development, economic development projects, which again, it depends upon where you are, it depends upon a lot of variables. But what impact has it had from your perspective on economic development initiatives?
Well, ironically, with respect to this project and the New Jersey Technology Innovation Hub, which we're breaking ground on later this summer, we were at a period of time where, working from home really didn't hurt us. We were doing a lot of planning. We were doing a lot of meetings. We were able to actually learn how to use Zoom. So we were able to move this project along It was very different doing, probably for this project alone, 10 public meetings to get the various approvals, and that was a bit of a challenge. So we didn't lose any time. What we're now facing, which is a little bit of the unknown of the cost of material. A lot of people are now getting projects going at one time, so I'm somewhat concerned about the availability of labor, and then certainly the supply chain with respect to getting materials from different parts of the world and different parts of the country. So there's a little bit of an unknown. I think everybody who's involved as a partner in this project really hunkered down, and we kept it on track. But we've got some hurdles yet.
By the way, before I let you go, the name of the new cancer center will be?
Dr. Libutti?
So we're very excited with the generosity and commitment of Jack Morris, who is chairman of the board at RWJ University Hospital and the inaugural chair of the RWJBarnabas Health System. The new pavilion will be called the Jack and Cheryl Morris Cancer Center at RWJBarnabas Health and the Rutgers Cancer Institute in New Jersey. And we're ecstatic to have Jack and his family associated with this project as he's been instrumental in driving this vision forward.
Thank you, Dr. Libutti. Thank you, Chris. We appreciate you being with us, and we'll continue to follow the development of this initiative. Thanks so much, gentlemen.
Thanks, Steve.
Stay with us. We'll be right back.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
We are honored to be joined by our longtime friend, Elisse, Glennon, Executive Director of the New Jersey Sharing Network Foundation, and Paul Jova, Board Member of the New Jersey Sharing Network Foundation, and the father of Andrew, who was an organ donor. And by the way, thank you, Elisse, for joining us, and definitely, Paul, we're honored by you being with us as well.
Well, thank you for having me today. Appreciate it.
Paul, I want to start with you. Tell us about Andrew. 2008, he lost his life at 17 years of age. A decision was made to donate his organs and to give the gift of life to so many others. Can you talk about him and that decision?
Well, Andrew was your typical 17-year-old waiting to get his driver's license, being driven around by myself and my wife. And one night, tragic accident, he decided to do something a teenager, thinks he could, something impossible, jump out of a car, roll and just get up and walk away. Well, it didn't happen. He struck his head on the curb. And that's the moment our lives changed. My wife, my whole family's lives changed. Andrew was rushed to the hospital. I met him there. And for 2 days, we were in that hospital room waiting for a miracle to happen. Andrew was a giving, caring young man, always full of life and energy. And, to see him sitting there waiting for life to be brought back to him really impacted my wife and myself. His story is, a story of just, he wanted to give back. He always was looking to help other people, always. The day of his accident, he was at a youth ministry in Camden, helping other kids, less privileged than him. And he came back and this little accident happened. And like I said, it changed our lives. Andrew was a great kid.
And the decision was made to donate his organs?
Yes, the decision was made. We were in that hospital room waiting for a miracle to happen. And when the New Jersey Sharing Network representative approached us, my wife and I decided at that moment to donate his organs because we didn't want another family to be sitting there waiting for a miracle to happen and not get it. We didn't get that miracle, but we wanted to help someone else. Maybe they can get the miracle they deserve.
Elisse, you've known Paul for a while. You know the story about Andrew, about their family. When you hear it in this setting, and it replicates, unfortunately, so many other stories, but on the upside, so many opportunities for the gift of life, not for the right reasons or good reasons, but it happens. Your reaction to listening to him?
hearing Paul, I'm hearing you talk about Andrew, and it's no surprise because I've known you and I've known Jen for so long. It's no surprise to me that Andrew would be such a giving boy, such a boy who was in Camden helping others that day, because that is how I know Paul, that is how I know Jen. That's who they are. That's who the Jovas are, very giving people. And so I've heard the story before, but every time it's like I'm hearing it for the first time. And I'm wishing we were in studio right now so I could put my hand across the desk and reach out to Paul.
Elisse, we've had so many conversations. We've had a relationship for a long time with the Sharing Network in terms of public awareness. Creating more public awareness around organ and tissue donation. To what degree did Paul just send a message to so many others about what they could and should be doing to give the gift of life to others? And you can do that on your license, if I'm not mistaken, your driver's license, correct? Or you can go to the New Jersey Sharing Network website, which is up right now. Please, Elisse, go ahead.
Yes, you're right. We encourage people to learn more about organ donation. It's a very personal decision. You heard Paul talk about the decision that he made with his wife and that Andrew made as a donor himself. So it's very personal. We want you to learn more and talk to people listening to Paul's story, hearing someone who made that decision and why they made that decision, I think really helps someone think, kind of within themselves. And like you said, you can register at motor vehicle, you can register at our website, and you can register right on your iPhone.
Hey, Paul, what is it that you do want to say? By the way, the Transplant Games, let's let everyone know, the Transplant Games, July 16th to July 19th at the American Dream. Real quick, give me 20 seconds on that, and then I'll come back to Paul. What are the Transplant Games, and why do they matter, Elisse?
We're thrilled to partner with American Dream to bring our life-saving message to that property and to the thousands of people in and around hundreds of thousands of people in and around New Jersey, and then millions around the world to share our message, particularly of hope. Paul shared his story. He talked about the family on the other side of that story receiving the life-saving gift. And the Transplant Games are our opportunity to bring the entire community together on the donation side and the transplant side to celebrate life and give hope.
Paul, what would you say to everyone else watching right now who not only is moved by you, respects you and your wife Jen tremendously, and trying to imagine what kind of young man Andrew was, by the way you described him, all positive, right? What would be the message you would want to share with everyone right now?
Miracles can happen. They happen in many different ways. We can affect people's lives greatly just by taking a moment and realizing that all you have to do is check that box and you can save a life. And I've met many people that his organs and his tissue have impacted, and their lives and their families' lives that are impacted. That little ripple effect of how one little thing can change. It's not a little thing, excuse me, but one thing can change so many lives for the better.
By the way, what do the Transplant Games mean to you, Paul?
Well, I was lucky enough to be at the Transplant Games in Salt Lake City. And yes, and it was one of the most memorable moments in my life to have strangers come up to me, never met them before in my life, and thank me for making that sacrifice. And it's not my sacrifice, but my son's sacrifice. And my wife and I were overwhelmed with joy to see the life impacted by other people and how they're living their lives because of decisions made at one of the worst possible times. The Transplant Games are undoubtedly one of the greatest events around. And I can't wait. It's amazing.
Paul, real quick, before we have to end this segment, unfortunately, because of time, the 5K Celebration of Life, I believe, is on September the 12th. Help me on this, Elisse. Listen, we'll be there. We look forward to it. It's been years that we've been physically there in New Providence, interviewing families and people who have given the gift of life, received the gift of life. Tell everyone what's going to happen that day.
So we're on Sunday, September 12th in New Providence at New Jersey Sharing Network headquarters. We will be over 10,000 people strong. We are excited to come back after 2 years not being together. Last time we had a 5K was back in 2019. So we are looking forward to seeing our whole community together, sharing stories together. I'll be giving out free hugs for the day. We haven't been able to do that in so long. And we're so glad that you're going to be there with us, Steve.
And more importantly, Paul's going to be there.
I'll be there. Team Andrew will be there. 75 strong. I happen to be the co-chair this year. But yes, 75 strong members will be there, keeping Andrew's name alive.
Hey, we will be there, and I look forward to being there with you, Paul, and to you, Elisse, and to Joe Roth and the great team at the Sharing Network. Important work, and the work is never done. People are waiting across this state and nation for their life to be saved, their lives to be changed, waiting for an organ. Hey, Elisse, Joe, thank you. Excuse me, thank you so much, Paul. I'm talking about Joe Roth's on my mind as well, your CEO. Thanks so much for watching. We'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Education Association, Johnson & Johnson, MD Advantage Insurance Company, NJM Insurance Group, the Fidelco Group, the New Jersey Board of Public Utilities Clean Energy Program, Prudential Financial, and by the Adler Aphasia Center. Promotional support provided by Meadowlands Chamber and by bestofnj.com.
New Jersey's Clean Energy Program offers financial incentives for New Jersey residents, business owners, and local governments to help save energy, money, and the environment. Learn more at newjerseycleanenergy.com or call 1-866-NJ-SMART. New Jersey's Clean Energy Program. We're lighting the way to a clean energy future.